So just giving you guys a heads up on that. Many of you attended the A-WEAI Validation Community of Practice Kickoff Workshop back in October last year. And thank you so much for attending and continuing to attend events that we've been organizing. So in response to your feedback and to better represent what we're trying to do here, we're calling this community of practice Women's Empowerment Measurement Validation Community of Practice. So for short, it's We Validate. And this is our inaugural webinar. So thank you so much for joining, and thank you to Lily and Lindsay for presenting at the first webinar. Just a little bit about how we plan to do these. We're calling them webinars, but we're intending for them not to be these big formal, like we present and then just have a Q&A at the end, but rather to be a little more interactive and to actually be the stepping stone to building this community of practice. So we really appreciate you joining and hope you'll continue to join our webinars for the rest of this year. So Lily and Lindsay will be presenting on A-WEAI or A-WENI, assessing concurrent and predictive validity of women's empowerment measures in Andhra Pradesh, India. I'll do quick introductions and then we'll get started. So Lily is an interdisciplinary researcher with expertise in global health and nutrition, program evaluation, development economics, and quantitative methods. Her research focuses on assessing the effectiveness of complex nutrition-sensitive and nutrition-specific interventions and the mechanisms through which they work to improve maternal and child health and nutrition globally. Lily has many years of experience examining the effects of nutrition-sensitive agricultural programs. After completing her PhD at Harvard, she joined the Bloom project team to lead the implementation, analysis, and presentation of outcomes relating to women's empowerment and child growth and development as part of a randomized evaluation of an agroecological program in India. Together with Dr. Lindsay Jaacks, Lily is also examining the effects of prenatal and postnatal exposure to pesticides on child development in low and middle income countries. Welcome back to IFPRI, Lily. Next, we have Lindsay Jaacks. After studying nutrition and epidemiology, Lindsay joined the faculty at Harvard University as an assistant professor of global health, where she established and led a research team working on global non-communicable diseases and developed the obesity transition framework. While at Harvard, she also developed and taught field-based classes on NCDs in India and Nepal. This work motivated her to adjust course and refocus on the underlying causes of disease. Lindsay joined the University of Edinburgh in 2020 as a UKRI Future Leaders Fellow and Chancellor's Fellow in the Global Academy of Agriculture and Food Security. Her current research projects broadly aim to advance understanding of the nexus between agriculture, nutrition, and health. She's especially interested in studying the effects of pesticides on human health and the health co-benefits of sustainable agriculture approaches, such as organic. Her research also involves improving the measurement of food environments and leveraging citizen science for public health nutrition. Welcome, Lindsay. Before we start with Lindsay and Lily's presentations, we're going to have a quick poll that Lindsay and Lily have put together. So I'm just going to share my screen here. We're going to use Mentimeter. So if everyone could go to menti.com and enter this code 58479026, or you can use the QR code on the screen.
We can see your screen,
oh.
Simran.
That's weird. Now do you see it?
Oh, yep. Yes, perfect. Now we do.
Okay, great.
So we have just a couple of questions to kind of more as icebreakers and to get a sense of who's in the audience. And we're just, our first question is, well, that's
I'm waiting for people to join. I see about, I think 7 have joined.
I'm joining too.
Yeah, these little hearts in the corner.
Okay, you have to start it, I guess.
Numbers
yeah, I'm just waiting for enough people to join.
With the little hearts.
Okay,
So yeah, our first question was, which women's empowerment measures or metrics are you currently working with, if any? So feel free to throw in, in our case, A-WEAI, WENI, any other abbreviations, pull out new ones that we don't know about.
And you can put in up to 3, so you can go ahead and add more than one.
Oh, cool. Lots of WEAI and pro-WEAI. I'm not participating, full disclosure. We're way heavier on the WEAI and the WENI. Arise. Cool, WEAI heavy crowd.
Okay.
WEAI is the livestock index, right?
Yes, it is. Then we have well-being and WEFI, pro-WEAI market inclusion.
We have JCSV. I haven't heard of that. Oh, WEAI, pro-WEAI add-ons.
If anyone has trouble with the Mentimeter, just feel free to unmute yourself and just ask us the question.
Yeah, I think we have 22 people so far, right?
Yeah.
Empowerment and migration.
And we have about 30 participants, so that's, and none of us are putting in, well, I haven't, Lily hasn't, so.
Yeah.
I think we can move on to the next question. Yeah, Lily?
Yes, sure. This is very cool. Lots of people working on different things. And then the second question, we were just wondering like how familiar people are with the A-WEAI and the A-WENI that we'll be talking about, like not at all to I've used it multiple times, know it very well. Not that we'll be going into the metrics in much detail, but just curious what people have used in the past and what they know about. Simran, how are we interpreting these numbers?
So the not at all is your first option, which is we don't, and the option 2 is I've heard of it but never used it, and option 3 is used it in at least one study.
Got it. So 2.5 is people leaning towards have heard of it or used it. And then with A-WENI, we have people that have either not heard of it or just heard of it. And 2.2 is our average.
That's the average of both. I mean, I wasn't quite sure what that line was going to do, but it's in there. So I think we'll get the data from this that I'll share with you after, so you have a sense of.
That's super interesting.
But basically, it looks like the most of our audience is more familiar with the A-WEAI versus the A-WENI. So here you go, Lily. If I just put my mouse over it, you can see how many people.
And that makes sense because A-WENI is newer than the A-WEAI, so not surprising that more people know of the WEAI. Okay, great. Thanks everyone for participating in our little poll.
I'm going to stop sharing now and over to Lily and Lindsay to present.
Thanks, Simran, and thanks everyone for joining us. We're really looking forward to sharing our work today and learning from the vast experience of this group. Since this is very much work in progress and we're starting it later this year in a couple of months. So as we're going through the presentation, we'll have a discussion afterwards, but if there are any questions that come up or anything's not clear, please type it in the chat and then we'll chat about it afterwards. So I'll go through a little bit of background and then Lindsay will walk you through the context in which the study is happening. This is very much not a crowd that needs convincing that women's empowerment is important. Many of you, if not everybody, has worked with women's empowerment metrics, both conceptually and empirically in some capacity or other. And you probably know that that's one of the main pathways through which we expect agriculture to improve women and children's health and nutrition. But in low and middle income countries, evidence very much remains mixed and inconclusive. We know about various challenges related to measuring women's empowerment, its multidimensionality, and lots of issues that I won't mention in details, but standardized metrics like the A-WEAI, the A-WENI, and the abbreviated versions are very much designed to address these challenges and standardize how we measure women's empowerment in field studies. However, for these specific metrics that we'll be talking about today, there's still limited evidence on the validity against nutrition outcomes. And specifically, there's limited evidence in India. So where we were coming from, as you see from the context, we're doing a study in an agricultural context and we're measuring nutrition outcomes. So we were like, should we use the A-WENI or the A-WEAI? Which tool would be better? And we came up with this additional validation work that we're talking about today to understand the concurrent and the predictive validity of the two metrics and just generally how they perform in the same context, in the same sample. So we have four specific aims that I'll discuss in a little bit more detail. But first, we want to assess the concurrent validity of the two metrics, so how they're associated and how they rank individuals. We want to look at their predictive validity against a range of women and children's nutritional outcomes. We also want to look at whether one or the other metric is better at capturing the effects of agricultural interventions on women's empowerment, or how their sensitivity in this aspect compares. And lastly, we want to look at to assess the two metrics as mediators of intervention effects on women and children's nutrition outcomes. And I'll describe these in a bit more detail, but now I'll pass it over to Lindsay to describe the context and the overarching study under which this work is being conducted.
Thanks, Lily, and thanks everyone again for the invitation to present today. I'm really looking forward to learning from all of you and have already learned so much from Lily. This is definitely not my area of expertise, but I think it's a really great opportunity to integrate these metrics into our ongoing evaluation. So the Bloom project is looking at co-benefits of large-scale organic farming on human health. It's the first, as far as we're aware, it's the first randomized controlled evaluation of the health effects of organic farming. And we're primarily, when we started thinking about this and when we got funding for this study, the main interest was in the pathway between reducing pesticides and health effects. Because we know pesticides are widely used, and our pilot data suggested that as well. And we know that pesticide exposure is related to adverse health effects. And so that was really kind of the primary driver. But the more we learned about this program, which is not just about eliminating agrochemicals from agriculture, but also it's about women's empowerment, particularly because the program is increasingly being implemented through women's self-help groups. And it also has components around, crop diversity, growing, having 365 days of ground cover and growing a diversity of crops on the fields. And so we're increasingly realizing that there'll be many different pathways that we'll be measuring as the trial goes on that might have an impact on health. And so that's kind of the background of the study. So I think on the next slide, if I'm remembering the order correctly, yeah. This is a randomized control evaluation of organic farming. The specific program is the Andhra Pradesh Community Managed Natural Farming Program. It's a statewide government program that is being implemented down in South India. It started in 2016, but only recently has it been scaled up to a large proportion of the states. It's about 1 million farmers out of 6 million who have received the training so far. And we have a MOU with the government and have developed relationships with the government over the past 1 to 2 years, I guess. And they've agreed in 2 districts to allow us to randomize the order in which clusters receive the program. The people who are implementing it are these CRPs, community resource persons. They're training farmers, but they're really, in particular, mobilizing women's self-help groups, as I mentioned. And I think that's one of the key components that relates to the women's empowerment metrics. In terms of location, just a map to show where Andhra Pradesh is in the 2 districts where we have an MOU with the government. These are Kurnool and Vizag. Kurnool is quite close to, it's like about a 3-hour drive from the capital of that district to Hyderabad. Vizag is on the coast, and they're really quite different geographies. One area is, Kurnool is heavy in terms of irrigation, a bit more cotton growing there, cash crops instead of just rice like in Vizag. It's a much drier area. Vizag is much less irrigation, much more rainfall. So they're kind of different climatic zones, which is quite interesting in the context of this evaluating this program. In terms of sample size, we have 80 clusters, 40 in each of the districts. Half will get randomized to receive the program immediately, and the other half will receive it after 2 years. And then within each cluster, we're enrolling about 34 households that will be followed over time. And in each household, we'll be enrolling an adult woman and man, as well as a child under 3. The household has to have a kid under 3 at baseline to be eligible for the study. So in terms of outcomes, we have 2 primary outcomes. The first is urinary pesticide exposure, which we expect will, as farmers stop using these chemicals, we expect that exposure will drop pretty quickly based on some randomized controlled feeding trials of organic food. And then the other primary outcome is dietary diversity. And we'll be measuring both of these in both the adult male and female, as well as the kids. We have loads of secondary outcomes, as you can imagine, for these types of big trials. Of course, we're looking at crop yield and household income as potential mediating pathways. We're looking at diabetes, kidney function, lung function, and various symptoms, mental health, and of course, women's empowerment, which is what we're talking about here today. Lily, are you?
Yeah, I can pick it up.
This one? Okay, great.
So we're collecting data at 3 time points, baseline, a 12-month follow-up, and a 24-month follow-up. So here we've outlined which of the 4 aims we're hoping to address with data at each time point. So baseline's coming up in a few months later this year, and with the baseline data, we're hoping to look at concurrent and predictive validity. Then in 12 months, we'll look at aim 3, so the ability of the 2 metrics to capture intervention effects. And we're also hoping to potentially look at the longitudinal invariance of the 2 metrics. And lastly, at 24 months, we'll again look at this ability to capture intervention effects and mediators. So now I'll talk a little bit more about what each of those aims entails. So in terms of concurrent validity, what we're going to do is sort of follow the methods used to derive the A-WENI and the A-WEAI to compare the 2. So look at Kendall, Taus, Bierman, row rank order correlations, do a ROC analysis to look at how the 2 metrics are ranking empowered and disempowered individuals, and then specifically kind of focus more on the mismatch group, as we expect that there will probably be some mismatch between, one tool's ranking you as empowered and the other as disempowered. So we'll focus a little bit more on this group and try to understand some of the characteristics of the mismatch group and where this mismatch is coming from. In terms of aim 2 and predictive validity, there is, as I mentioned, some evidence on how A-WEAI and A-WENI are associated with some women and children's nutrition outcomes, but in different samples collected at different types. So here we're just going to look at a range of like everything we're collecting, both continuous and binary outcomes, to really understand how the 2 metrics are associated with these outcomes. So we'll look at women's underweight, anemia, dietary diversity, children's nutritional status, IYCS practices, early childhood development. We'll also try to assess heterogeneity across district, wealth, women's education, and age, to kind of look at whether these associations are different by these kind of standard socioeconomic factors that we collect. Then in terms of aim 3, this ability to capture impacts, what we really want to look at is whether the intervention is impacting A-WEAI and A-WENI at 12 and 24 months. Because like to our knowledge, this hasn't been done with 2 metrics, and it's possible that one is better at picking up early effects, the other is better at picking up effects later at 24 months. We really just don't know. So we'll look at that at each time point, and then potentially also use mixed effects models to look at this more longitudinally with the 3 time points. And lastly, this question of mediation, we've put here a very basic path diagram as we hypothesize that women's empowerment is one of the pathways through which this intervention could improve nutritional status. We really want to look at the indirect effect through women's empowerment. So what we'll do here is just swap women's empowerment, run this model with A-WEAI and A-WENI and quantify these direct and indirect effects. Which again will kind of build the evidence of which tool we should be using. So before we jump into the discussion, and for this we'll use Padlet. So in a second, Simran's going to walk us through how to use the Padlet. We have 5 questions there that we have for the audience, sort of we want to discuss in a bit of detail, and they're mostly around kind of the logistics and implementation of the tools in the field, as we want to make sure that that it's, we have these metrics in the surveys, but we want to make sure that they're easily implemented and logistics are optimized, but at the same time, that's not somehow compromising this validation exercise. So one thing we are wondering is whether we should administer both the A-WEAI and the A-WENI module on the same day, or could we administer them on a different days? What are the implications of doing that? Another issue we're considering is the order in which the survey modules are asked. If they're asked on the same day, should we randomize the order? So I get A-WEAI first and A-WENI second, and Lindsay gets A-WENI first and A-WEAI second. Does this matter? Obviously, in terms of respondent fatigue, it matters, but for the validation work, does it? Our third question is sort of whether we can disperse some of the WEAI and the WENI specific questions in other parts of the survey. As you can imagine, given our outcomes of interest, primary and secondary, we have a very large survey. So we're wondering, what does it do to the survey modules if we just move some of the items around, like WEAI, for example, collects data on assets. And that's something we can incorporate with the household survey. So then we make the empowerment module a little bit shorter, maybe decrease fatigue, maybe speed up the interview. So how does that affect validation? Our fourth question is sort of how do we determine which tool is better? And what I mean here is what criteria we should be thinking about, because based on prior work with different empowerment metrics and the literature, we do expect to see inconclusive results, like A-WEAI is good for one thing, A-WENI is good for a different thing. So sort of what should we be thinking about when kind of writing up some recommendations at the end of this work, like when we should use A-WEAI and when we should use A-WENI. And the purpose of this kind of determining this now is to have these criteria from the start, potentially, like we'd like to publish them as part of an analysis plan with the prior registration. So it's all out there, and we know from the start, these are the criteria we'll be using. As you all know, that I think there'll be a lot of kind of soft decision-making here and more subjective than objective statistical kind of criteria. And lastly, on the Padlet, we have this general thoughts and discussion piece in case you don't have an opinion on these 4 questions, or there's something else that you found really interesting or really concerning and you want to talk about, that you can post there. And we're very much kind of looking for brainstorming ideas, discussion generating points. These don't have to be like thought out sentences that you put on there. Just really what comes to mind. And I'll stop sharing my screen now and pass it back to Simran, who
Thanks, Lily.
walk us.
Let's address some of these questions in the chat before we move to the Padlet. Lindsay, do you want to jump right in? I think first we should start with just some clarifying questions on what these prime differences are between the A-WEAI and the A-WENI to get everyone on the same page. And then maybe you can address some of the questions you've already started answering in the chat, and then we can move to the Padlet.
Okay. What are the differences between A-WEAI and A-WENI, right? Is the first question.
Yeah.
Right. So, I mean, we have the people that develop the WEAI here and the people that develop WENI who know much better. But basically, WEAI was developed to measure women's empowerment in agriculture, so agency and agricultural decision making. So it's very much being used for that purpose versus WENI is developed to measure women's empowerment in nutrition. So they're sort of measuring similar domains of women's empowerment, but ultimately they're different tools that ask different questions to kind of get at slightly different aspects of women's empowerment. And again, because we have this mixed context of both agriculture and nutrition, we were wondering which tool would be better to use. In terms of the actual surveys themselves, A-WEAI is substantially longer than A-WENI. A-WENI, I think if memory serves me right, it's about 20 questions. It's 20 or 30 questions. A-WEAI is longer. It's derived from the much bigger WEAI itself and asks a bunch of other questions that are important. They're more important to understand women's kind of agency and involvement decision making in various agricultural decisions and community groups and so forth. Thanks, Lily.
So there's a question on, did you use both tools with the same households? Just want to clarify that I think that this is like in the design phase. So
but that is what we're planning to do. Both tools to all participants. Sorry, that wasn't
both
clear.
tools in full, yeah.
Okay. I think that just to clarify with everyone before we move on to the Padlet.
I also just wanted to clarify that the ProWEA, even though it's designed, because I see some questions coming up about the ProWEA, right? It's being designed specifically for intervention effects, but it is actually longer than the A-WEAI. It has additional modules, and we were really looking for the shortest of those tools because again, like we have a very heavy questionnaire, and that's not just us with this study. We often ask so many questions that we're also looking for something that measures women's empowerment well, that can easily be added to surveys for, you know, large population level surveys like ours in a field setting where we're doing a lot. And, you know, we want to add, say, 3 modules, not 5. And really those 2 modules can actually make like a huge difference on the length of the survey and the training of enumerators.
Okay, great. If anyone has any clarifying questions that they think we should address before we move on to the Padlet, feel free to just unmute yourselves and ask them. Otherwise, we'll move on to the Padlet.
Yeah, I just had a question and actually I see Erin and maybe the rest of the WENI team might be here, so maybe they can respond. I was just wondering, is the A-WENI already kind of available, like the questionnaire? Because I think it sounded like from the earlier poll, it sounded like most of the people were more familiar with the WEAI tools, and maybe it would help to kind of see the questionnaire for the WENI or the A-WENI and kind of understand how abbreviated it is compared to the original WENI, which maybe some people are more familiar with. So so either in the chat or maybe Lily or Lindsay can respond. Or yeah, Liz, I see you just showed up. Go ahead, jump in.
Oh, you're muted. There you go.
I'm going to give a very unsatisfying response because both Erin and Sudha are not here, and they are the developers of WENI, and I am just working on the validation side, doing something quite similar to what Lily and Lindsay are doing in a different setting. So I can't say whether we can just I can't pop a questionnaire in the chat or whatever, but I can pass this on to Erin and Sudha to see if they can circulate materials that they have on the A-WENI.
I've got it open if you want me to screen share and people can glance at it. I don't know if that would be useful to people, but I'm happy to do that. It's only 24 or 25
Yeah,
questions.
I think it would be really useful because I feel like it would really help us answer the questions, the discussing questions. So if we could take just a few, like a minute or two to just look it over, that would be really great. Thanks.
Yep, no problem. Let me unclick optimize. Can you see that? Let me also make this smaller.
So I think the full WENI is now the questionnaire and all the translations I think are up online, right?
Yeah, I think so.
That as we were developing and translating the English version to Telugu. And
yeah. So I think many of these are similar to WEAI. But this is a big difference, of course.
Yeah, sorry. There are some knowledge, like nutritional knowledge of like what causes anemia.
Yeah.
Right?
Yeah.
And calcium. I forget if there was something around malaria as well. Iodine, maybe not malaria. I don't know what malaria would be doing there.
Yeah, it says, how does one get malaria? What's the best source of calcium? What food items help prevent iodine deficiency? So these are, of course, quite different than the WEAI. And then I think the next one's anemia. Yeah, the next one's on anemia symptoms. I think these mobility questions there's a mobility section of WEAI, if I'm remembering correctly too.
Liz, you can jump right in. I see your hand is up.
Oh yeah, please go ahead because I don't have the little list up.
Yeah, I just wanted to say that one of the things that we've been doing in our validation work in the last few months is mapping these different questionnaires to each other. And I would tell the group that there is shockingly little overlap if you stay very true to the questions, even though there's overlap in content. So this sort of starts to dive into the questions you have up on the Padlet. And I don't know if we want to go there, but you end up in this situation where you have to decide whether you want to ask each metric separately as a unit or start combining modules so your respondent isn't like, well, you asked me if I can go visit my parents one way.
Yeah.
And now you're asking me again in a slightly different way that to the respondent might just sound exactly the same. So I don't know that you want to dive into the gory details of that in this moment, but I would be more than happy to like meet with you guys and just talk through our process doing this something very similar. We just fielded our survey a few weeks ago. So this is all very fresh in my mind.
Yes, it would be great to connect on that. And which tools have you mapped?
So we've done ProWEAI, a longer version of WENI, but not the long version, WELI, and we've included the health and nutrition module for ProWEAI. And then we also are collecting the indicators associated with Sweeper, which are the DHS, it's like a handful of DHS questions. So we have we've mapped them all to each other pretty thoroughly and grappled with a lot of things. So
that's great.
Definitely connect on that.
Should we try jumping into the Padlet right now and then come back to Q&A? We'll do the Padlet pretty quickly, I think. So Ara has put the Padlet in the chat. I don't know if it's gone very far down the chat now that we have more questions in there.
Just reposted that again in the chat.
Awesome, thanks, Ara. Thank you. So these are the same questions that Lily had on her last slide. The idea of this part of the webinar is just to kind of, for for Lily and Lindsay to get feedback on some of these questions, right? And we thought this would be one quick way to do it. All you have to do is click on the link. They shouldn't ask you to sign in or any such thing. Pick a question that you think you can answer or would like to answer. Pick multiple questions if you like, and just click on the little plus sign below them, and you should be able to add a response. If you feel comfortable putting your name against your response, go ahead and do that, so that they can maybe reach out to you if they have any follow-up questions or want to connect with you to get more insights on it. But yeah, go ahead and just start throwing in answers there. So once we kind of get through these questions, we can move on to some of the other questions we had in the chat, and keep this kind of like an open discussion. And at this point, feel free to unmute yourself and, say you're like, my answer to this question is too long. I'm just gonna unmute myself and say it out loud. You're more than welcome to do that. Like I said, we're not trying to create like a very formal environment here. So, and Lily, Lindsay, feel free to jump in if you want to add any clarifying bits to this question. I know Liz just asked, like, was referring to a little bit, which doesn't quite answer the first question, but it does speak to doing both of the modules together. So yeah, feel free.
Yeah,
just a quick,
go ahead.
just a quick thing for those responding. I see, so you need to click on the plus sign below the question you're answering for it to actually show up in that column. Yeah, go ahead, Lindsay.
I was just going to say that question 3 is actually, we hadn't really considered merging the instruments or pulling some questions from WENI and kind of integrating them into the WEAI. But it's a really great idea, and I'd love to talk more about that. Question 3 here was actually around, these have been added to a larger trial where we've got loads and loads of surveys being asked. And we have, for example, really detailed surveys on assets. And so do we need to ask the WEAI specific assets in the WEAI, or can we just pull that data from a survey that's asked on a different day? So I think that that's kind of where that question stemmed from, and would certainly welcome people's thoughts on that. I'm not sure, Liz, if you had other surveys that were being administered for your study, or if it was just the women's empowerment metrics.
We did. It's complicated. I'll spare you the details, but the same questions. I wanted to ask, does the A-WEAI have the time use module in it?
Yeah.
Okay.
Yeah.
Yeah, and I think some of the A-WENI questions, I forget, Lindsay, if we moved them around or not, but there were definitely a couple there that were being asked in household modules, right?
Mm-hmm.
Definitely makes sense, Liz, you've done this. Just now, I will be in touch right after this to discuss with you further.
Sure.
And Lily, Lindsay, you can also feel free to just react to some of these responses as they come in.
I have a question.
Mm-hmm.
This is Gayatri. Hi everyone.
Hi, Gayatri.
So I might have missed this. It might have happened in the beginning of the presentation, but are these modules going to be asked? Is it just to the farmer, or is it sort of like to, primary male and primary female within the household, or I don't know if I missed that.
Yeah, they're being asked to both.
Okay.
Both parents of the child.
Got it. Okay.
Yeah. I mean, that's another, that really relates to, for example, the randomization and the administration, because the other question would be, if you go to the house to administer to both of them, but the husband is out for whatever reason, should they be separated? Should they be because if you ask the woman, then she might share the detail, before. So it gets quite complicated, the study design for administering these.
Well, this is sorry, I'm like reading through the comments. This first one on the time use module is really interesting.
Yeah.
That could be influenced. I had not thought about that. That's actually really important, because when you think about the past 24 hours, you're like, I spend my day answering your questions.
Yeah.
That was in the field, and we realized this on day one of implementing the survey. It just never occurred to us, and we are working in conjunction with another survey that's quite long, so we're interviewing across 2 days, and so we had to sort of rethink our entire logistics because of this.
Yeah, our current field logistics that we've piloted, the results of we're taking venous blood draws that are going to the lab for measurements, and we give a report back to the participants like a week later. And so it's like a week after a lot of the measurements that these would happen. So, and there's kind of the, not incentive, but they're receiving the lab results on that day. So it's kind of hopefully it will be easier to kind of schedule that and not have a lot of missing data. And address the survey fatigue to some extent, to have a bit of a break.
Since we have a lot of questions in the chat, I was thinking, let's give the ballot another minute or two, and then we can migrate back over to the chat and the Zoom to see, to look into some of those questions.
And there was, so this bottom question on the bottom right, the tools are somewhat different to compare, and why we didn't, yes, this one, why we didn't consider adding the health and nutrition questions as an add-on to the A-WEAI, because there was something similar in the chat around why not just use the A-WEAI with the health and nutrition add-on, but look at both tools. Because like we really just don't know which tool is more suitable to use in this context. So that's where we came from, wanting to look at both, because it is a government-run program and the government's very interested in women's empowerment, both as an outcome and as a pathway. So we are also kind of considering, like, we don't want to say that the program didn't work to improve empowerment and that to be a function of measurement. And there is always that risk with these various, like, non-standardized, like there isn't a single measure for women's empowerment. So if we get like a null that, the program doesn't work through empowerment, we want to be really certain in that. And we want to understand, well, or if it does work through empowerment, we really want to understand this specific pathway further. And we think that's best done by looking at two, I know, fairly different metrics. That really is true. That in terms of like the questions they're asking, but at the end of the day, they do measure aspects of empowerment. So there should be some overlap.
Great. Okay, I see that there's no one else typing anything in the Padlet. So let's move back. I'm going to stop sharing the Padlet screen. And let's move back to the questions in the chat. Let's see. So Lindsay, there was a question on the treatment arms, which I see you answered in the chat. Do you want to touch upon that a little bit?
Sure. Yeah. The treatment arm is it's a training program that the government's doing. So it's not, there's no provision of any inputs or any sort of cash transfer or incentive or compensation to farmers who join the program and practice APCNF. the early evidence suggests that it is really cost saving for farmers without dips in productivity, and depending on the crop that you're growing, particularly horticulture crops, there can actually be a boost in yield. So farmer income seems to go up when they adopt this approach, but it does require really frequent handholding. Like once a week, they're meeting with these government extension agents that are part of the program. So the intervention will be, taking fresh villages where the program hasn't been implemented in these districts and putting one of these trained community resource persons in the village. And one of the first things that they do is set up a demo plot, but they also work directly with the women's self-help groups to train them in the methods, in particularly in the preparation of the organic inputs, and also in kind of crop calendars, crop planning, particularly because they're really trying to get farmers to grow crops year round for that 365-day ground cover, which is a big emphasis of the program over the past year. So so it's a training program, basically. And the control group will not get the program for 2 years. So the government has agreed for our clusters in our study to kind of skip over them as they're scaling up.
Great, thanks. I think we have touched upon a lot of the other questions in the chat. I'm just checking, there's a couple of new ones that have just come in.
It's an interesting point. Oh, sorry. About
go ahead, Lindsay. No, go ahead. Go ahead.
I was just reading that time allocation question, and this is a big interest of Lily and I in terms of time allocation for organics. Maybe Lily, if you want to chat a little bit more about how you're thinking about that. But one quick question, we did modify the A-WEAI to be, I think it's originally every 15 minutes, and we have changed it to every hour. Is that right, Lily, or did we go with 30 minutes? Let me pull it up. I've got it right here.
If you went with 30 minutes or an hour, but we talked to some other folks that have administered the A-WEAI, and we identified that as the time module as one place where we can modify to cut the administration time specifically, because it does get little 1 hour intervals.
Yeah, just to jump in and add to that, I was also thinking, I don't recall exactly what the categories are in the time allocation module, but I wonder if it includes different agricultural activities like weeding, planting, land prep, all those kinds of things, which, you might see women's burden, in terms of weeding go up, and those kinds of changes you could pick up in qualitative work also in conjunction. So if you see changes in time allocation, you might not know exactly what's going on, but maybe some qualitative work could get at what the specific changes are in terms of women's labor allocation and their time burden. And the seasonal calendar that goes along with the WEAI tools, which is one of the qualitative tools that was developed, can be sort of helpful for looking at that and how that might change. You could probe how that might change with the introduction of these organic farming practices.
Yeah, it's a great point. I think right now it just is overall agricultural activities. One of the early, it's entirely anecdotal, just going out and talking with farmers a while back before COVID, when we were working on this proposal, farmers were saying that the main impact was that they may have previously been employed in other paid labor, wage labor, and when they adopted these practices, they no longer would be involved in that, either paid labor on someone else's farm or other kind of business, small business related activities or domestic, activities. And so we're quite interested in the impacts of that on income, because all of the work to date has looked at cultivation income. And we know, of course, in India that a lot of income for agricultural households comes from wage labor. So that could be, it's really the net income that we're quite interested in. But it's not, it's unfortunately, I don't think nuanced in terms of how much time spent in different activities. So we could think about that, Lily, if it's of interest.
That a bit.
Can
Yeah.
I just add something about this issue about the activity categories? So the way, I mean, the standard kind of list of activities that we have in the original WEAI, I mean, in the standard WEAI, I guess it's, it hasn't really changed, but those are kind of intended to be, one is that we don't want further collapsing. It's like that's the minimum kind of categories you could collect, because it's sort of distinguishes between paid and unpaid and domestic care and all these things. But if there are specific sort of tasks or activities that are particularly important in your project because of, you know, these pathways, then, I mean, you can certainly you know, train your enumerators to code different kinds of, you know, weeding, for example, as a separate category. And this is, so for example, I think a nice maybe example of how this is done is in the ProWEA for market inclusion pilots, where there we were trying to distinguish between time spent in different parts of the value chain. So processing, we wanted that coded as separate from like production activities. And so what we ended up doing was we had these kind of nested codes around, you know, if it was livestock, but it was selling, then it was kind of, you know, you had to click through a different category. So that's one way to kind of capture very kind of specific to get around this granularity issue. And you don't need to do it for the whole thing, right? You can only do it as long as the time, it's still a 24-hour sort of recall thing, but you can be granular on the parts where you care to be granular, right? And then the rest, if it doesn't, if, you know, you don't care to distinguish between certain categories, then that's also okay. You can keep that as is. I think that was all, but I also wanted to say something about the 1 hour versus 30 minutes versus the standard 15 minutes, because I think the original rationale for the 15-minute intervals, and this comes from the field teams themselves, they said it minimizes kind of the discretion of the enumerators to pick which categories get counted, because if the way it's asked, it's like a narrative, right? It's like, well, then you woke up at what time, and then what did you do, and for how long? And if they give you a duration that's kind of short, then it doesn't get counted, right? And then there's these rules around, well, how long is long enough to be counted? And so I think for the 15-minute interval, that would be like around 8 minutes, or if it's like an 8 or 10-minute activity, it would be count for the full quarter of an hour. And then if it's shorter than that, it just drops off and it's not counted. So just kind of, that means, I mean, my guess is that if you're looking at a 1 hour, anything that somebody does for less than an hour, in which case a lot of care activities are done intermittently or simultaneously with other things, then you may see sort of a systematic undercounting of those things which are very, which may have a gender sort of difference, right? These may be tasks that women tend to do more than the men. So that's all. Thanks.
I'm just going to jump in with 2 other questions in the chat. One is on whether you've looked at the A-WEAI HN, which I think is household nutrition, as like a catch-all for both these tools. The other one is on the empowerment scores for the A-WEAI, and if that's something that is generated and something you would compare. Then Greg also talks about the time intervals, and I think Hazel just touched upon that. But I'll give you guys a minute or two to respond, and then we'll close out so that we end on time.
What was the first question? Sorry, I missed that.
There's a question about whether you've looked at the A-WEAI-HN, which I think is household nutrition.
Yeah. No, we didn't look at that because we were just looking for I don't think I was aware of it, to be honest. Full disclosure, but again, focusing on something shorter than longer. The other question I saw in the chat and I started typing, about the A-WEAI and the A-WENI, in which scores we'll be comparing. So we'll be looking at kind of total overall empowerment score, because the A-WENI wasn't derived to represent all the domains that the WENI covers. So it's not like there's, for each domain, there's a specific number of questions that they wanted to derive. It's I think the final version was derived with like machine learning and lasso techniques. Although they used a bunch of different techniques and that were showing the same results. And circling back to Greg's question and the time use, I think that like discussion could just go on forever, and it's really interesting because like even, initially we do expect women to spend more time on all these activities, but maybe as they learn these new practices, organic practices, they'll start taking less time. And then there's a question that we'll measure at baseline and like 12 months after. So it's a really good question of like, what actually should we be measuring 12 months after? And do we expect to see any changes in time use at that point, or would women be used to it? So this is just like a lot for us to think about and really interesting thoughts, but I think like further kind of discussion and modification of the time use module maybe necessary on our side to like really capture things that are important.
Thanks, Lily. Thanks, Lindsay. We have 2 minutes left. I'm going to hand over to Hazel for some closing remarks. Hazel, over to you.
I think you summarized it, Lily, very well, that this discussion could last forever because there are just so many kind of decisions to make and kind of all these trade-offs that you're sort of grappling with resource constraints and everything else. So first of all, thank you both for coming in and sharing your plans and kind of asking us all these very thought-provoking questions. And thanks to everybody who showed up today and your contributions and all your questions. I'm sure you're giving the team, the Bloom team, a lot of food for thought. I would also say, like, I think we brought out kind of a lot of also interesting things that other people are doing. So the stuff that Liz was sharing, yeah, please share that with the group. I think that will be helpful for the whole community. So this is just the beginning, you guys. This is like first webinar for the year. So I'm certainly looking forward to the remaining, the rest of the series. And please sign up. Like, I know you all are doing amazing work. We know this. This is why we invited you to this community. So, as you're building out your plans, please consider, doing a webinar here and sort of having more of these fruitful discussions. We have the next webinar is coming soon, end of March. Please watch out for the announcement. And other than that, just a big thank you, applause to Lily and Lindsay. Thank you so much. And thank you all for joining us today. So Simran.
Thanks so much.
Thanks, everyone.
Is that it?
Thanks for the participation. I think this was a very, very good, fruitful first webinar. I'm glad that we had so much audience participation. Lily, Lindsay, I hope you got some responses to your questions that were useful. And the discussion was helpful.
By the way,
Mm-hmm.
Please don't hesitate to follow up. So I think there are kind of threads of discussions that require like further conversation. I think we should definitely follow up. I have a few other things that I was like, oh, I need to talk to Lily about this. So
I just wanted to add that we're going to share the recording and the Padlet after the webinar. So I think people can continue to provide their input right there.
Great.
Yeah.
Fantastic.
Sounds good.
All right.
Thanks, everybody.
Thanks, everyone.
Thank
you.